backgrounds are able to access the opportunity in their region. So you asked about our strategic plan. We've looked at that. And good work was done at that time. I got to say, it was really narrow in its focus. And so we are actually looking at expanding that to take on more issues and infuse this work more specifically into the performance plans throughout HUD's programs.
Can I just say one thing? Yeah, for what it's worth, as the sole one of the two advocates up
Yes.
here, just to reiterate, I think that the point that revisiting and in some cases even creating strategic plans, just be mindful that, as you guys are looking at this within your respective agencies, of which you're, uniquely situated to kind of deal with specific impacts, recognize that with this interagency panel, you actually have not just the opportunity, but the obligation to share those strategic plans across agency lines to kind of continue breaking down the silos, because as anyone here could tell you, our communities cut across all your jurisdictions, you know what I'm saying? And to the degree that your strategic planning efforts can help inform each other's operational priorities, try to be mindful of that. And again, to the point, clearly it's a new world, right? It's a world of climate adaptation, community resiliency, and to the degree that those strategic plans even contemplated that, I'd be shocked if any did. So, and the reality of climate justice for our communities cries out for that kind of coordination. So, thank you.
Thank you. I think we're going to go, just so that I don't keep looking to the left, I'll go over here first.
Hi there, I'm Larry Cohen. I'm from Prevention Institute, which is in Oakland and works a lot on community health strategy, and I think Secretary Sebelius described the work really beautifully. In background to my question, I should say a lot of our work is on health inequities, and most people, when they think about health inequities, think about fixing what goes on in the medical system. In fact, behavior and environment are responsible for 70% of our health in the medical system, maybe 10 to 15. Healthcare maybe 10 to 15. So we're really, really talking about the community environment in terms of fostering good health. And I think the Secretary did a beautiful job of describing what that looks like, what it means, why focus on the environment, and then kind of switched over to environmental health as though it was kind of a different issue. And in my mind, we're talking about healthy communities. I'm so glad to see Parks here. When I think about healthy housing, I think about lead. I also think about safety. I think about safety in terms of the stairs, but I particularly think about safety in terms of violence prevention. And it seems to me that we should be dealing with the issues of environmental health and health more generally, and both as parts of environmental justice, focusing on the community environment in a more coherent way where, the way I like to describe it is a good solution will solve multiple problems. And the question is, what do we need to do to take the next steps? It's easy to say we need to collaborate. It's easy to, talk about a specific program. And I'm thrilled at the level of collaboration in this administration. But I think we need to push the envelope. And I'd love to know what you think we need to do to push it further.
Rajiv?
I'm Rajiv Bhatia. I'm a physician, and I have directed the environmental health programs in San Francisco since 1998. The Secretary, I think, raised a very sort of important but almost obvious question. When we make decisions, we should be asking how they affect health. When we do things, we should be asking how they affect health. And it's surprising, and it's wonderful to hear her say that. It's also surprising that it's taken us so long, I guess, as a society to formally recognize that we need to ask the questions. In fact, we asked those questions. We asked those questions in the National Environmental Policy Act. We asked those questions in the environmental justice. They're the same questions I think we've been asking. I think part of the answer for us on next steps, and I'm speaking from the standpoint of a local public health agency, is to get to the truth, is to get to the analysis in answering the question. And we were pushed on this issue by our local community organizations. They pushed the whole city government to do the community impact analysis, social impact analysis, in the context of what was called smart growth development in San Francisco in response to the boom. They were concerned about issues such as displacement and the lack of resources and the displacement and the loss of jobs. And they wanted all that analysis done. And as the health department, they came to us and asked us, and as we looked at it, we saw that all these rules and these mandates exist for doing the analysis, but that analysis wasn't being done. And in fact, methods existed for doing the analysis, and those methods weren't brought to the particular local decision-making context. And so one very simple thing we did is we dusted those methods off the shelf from where they exist in the research literature and the academic literature, and we brought them into local public health practice. We did analysis that actually corroborated the community's claims, not on just issues of toxics, but on issues of the need for community infrastructure. This had an effect. It caused the fact that the planning department was now hearing both from the health department and the community groups and was hearing the same methods, forced them more to take notice. We were able to prevent displacement. We were able to make some pretty substantial changes in the planning process. So I think one of the key important lessons in terms of next steps is that that analysis needs to be there, and we need to sort of put it into the DNA of the system on a regular basis. So it isn't going to be just dependent on who is there running the controls at the time. That analysis needs to be sort of grounded and directed by community groups. And I think we have some great examples, have been privileged to have some great examples of that in San Francisco. We need to use, I think, NEPA is a tool that is, and CEQA in California, the parallel tool, is a tool that's widely disparaged, and it's kind of funny that these tools are often disparaged by the people who are in charge of doing them. And that really, and that doesn't make you feel very confident that they're going to be implemented very well. And I'm speaking really, I don't know where I'm speaking about exactly. But these are really, I mean, NEPA was a law written 40 years ago that really spoke to these issues, and now it really is about accountability and implementation, not about almost not really about a new policy. And I think that's a lot of what we're hearing. And maybe the final kind of, maybe another next step is that everything we're trying to analyze, health people typically wait for a problem to happen and then analyze it and say, oh, that's the cause of it. So everything we're trying to analyze prospectively, we should be able to put in as rules that govern the system, performance indicators of the DNA that kind of drives the system. And I'm really encouraged to hear that what I'm hearing from HUD about how they're planning to do that is really encouraging. And finally, these collaborations are great, but from our experience, it takes more than simply the collaborations. It's going to take advocates within the system that are willing to push against really rigid cultures and really rigid mindsets. And it is slow and patient work, and we do need those who are in the not in the government to really push us from the left, push us from the outside. I want to get beyond left and right. It's like this is not a left and right. It is not a left and right issue. They're health issues. But understand that we're also working to change a very large ship.
Terry, do you want to?
Yeah, I was just going to, I'm from the Health Resources and Services Administration and Department of Health and Human Services, and I just wanted to underscore what you had to say, how important it is, that we bring prevention into this. HRSA, which is the name of my agency, hadn't traditionally been as involved with the public health field, and in the last, I'd say, year or so, we've really moved more into that. We are very involved with a number of these initiatives, including environmental justice. HRSA is the safety net organization for the nation. You all may be familiar with our agency because you have community health centers, and we support those community health centers. So we're already in the communities, and we've taken a little different tact, in that we want to to infuse more of the public health approach to our programs. So, I mean, HRSA is more than just the community health centers, but that's probably where you all are familiar with our agency. So I think what you said was really important, and I've seen a movement towards involving more of the agencies within HHS in this particular issue, which is good. So.
Okay, why don't we take, I'd like to take two questions, one from this side and one from this side, and then get answers from the panel, just to make sure that we're getting as many questions as possible. So, I don't know, who over here?
Thank you. I'm Stephanie Tyree from West Virginia. I wanted to address something that was said in an earlier panel, and I'll connect it to health, don't worry. But, you know, a panelist earlier said that we need to be patient, and I don't feel very patient right now, and I haven't heard anything today that makes me feel very patient. I've heard a lot of, we're working on it, we're on it, and that to me doesn't mean anything. You know, you saying that you're in the communities, that means a little something, but I actually have never heard of your agency before or the communities. So,
Have you heard of health centers, community health centers?
yeah, I have, but in my community, the community health centers are deficient. So anyway, what I wanted to say is that I feel impatient because in my community, and I think in all of these communities, we're in a health crisis. I work with communities where they have red water coming out of their taps. And I know that that's not necessarily unusual, but it's unconscionable. People should not have to drink red water. And people should not have to drink red water for decades or for their entire lives. And we need health agencies to come in from the federal levels, because on the state levels, our health agencies are doing nothing. They're not even looking at things that could be in the water. They're looking at E. coli and saying that the water is safe when there's heavy metals and other things in the water. And the other thing that I wanted to say is that we are dependent on federal agencies for funding of studies a lot of times. And for us in the communities, these studies are essential because our states tell us that things are safe unless we can show that they're not safe. You know, so we have coal slurry being injected underground in my community, and our state says, well, we don't know that it's not safe, so we're not going to say that it's not, and that they let them do it. But to get a grant to study this at the federal level, you basically need a PhD. So I guess what I want to say to you is make the grants easier to get. You know, make the studies easier to get. The EPA has done work on this, but NIEHS needs to do work on that too, because we need you to come into our communities and help us.
Okay, can we go over here? Penny, how about, do you have a question?
My name is Penny Newman. I'm from Southern California with the Center for Community Action and Environmental Justice. We've been working on EJ for 33 years. And when we were back in those days, we were told that the science wasn't there, that you had to have the science before we could do anything. We have the science now. And I don't know how many times we have to prove it over and over and over again before something gets done. Earlier we heard from Chicago the problems with goods movement and the exposure of communities to diesel. We're at the other end from California, and the San Bernardino rail yard is the hub that brings to you. And yet we have the science telling us that diesel is deadly. It is killing us. And the only response we get is, well, we'll put traps. We'll get clean trucks. There's no such thing. You know, we reduce the volume of the particulate matter, but the hazard is not being reduced. The deadly part is in the ultrafines and the aerosols, and the traps and the clean trucks and all of that do not address the ultrafines. So for the community, we are spending millions of dollars on a superficial approach when our communities are still dying. And we're told, well, look what we're doing for you. Well, it's not enough. In San Francisco, you may have the health department and the health people stepping forward. We don't all live in San Francisco. In our health department, they are not present in the discussion about goods movement or any of the other issues that affect our community. Yet this is a health issue. When you talk about EJ, that's the first thing that comes to people's